coming. As we all know, depression is a very serious illness and condition that has taken a toll on many people too. Some we know and love, or maybe even ourselves. Phi Theta Kappa, the Psychology Club, with the sponsorship of Student Life from Broward College, welcome to all of you to this event, National Depression Awareness Day.
Today with us, we have amazing speakers in the field of psychology presenting different aspects of depression. As we saw in the PowerPoint slide, anyone could be suffering from depression. Some talk openly about it, and there are millions of people who are struggling with the symptoms of depression. The dynamics of this seminar will be after each speaker a presentation, you will have a chance to ask questions related to the field. Our first speaker, it is a great pleasure to introduce Dr. Melinda Shoemaker. Dr. Shoemaker is a college professor and psychologist. She did her master's degree at Nova Southeastern University, where she graduated as a counseling psychologist, and her doctoral degree at Union College in clinical psychology. Currently, she is one of our faculty members, advisor of Psychology Club, and teaches general psychology, advanced and abnormal psychology, marriage and family, and human sexuality. Dr. Shoemaker specializes in the area of depression and anxiety. Dr. Shoemaker will open our series presentation talking about depression, factors, causes, and latest treatments. Now, can you give a big round of applause for that?
Thank you all for coming today. We really appreciate you celebrating in National Depression Awareness Day. Clearly, as you saw in the videos, anyone can suffer from depression. No matter how happy they look, no matter how wealthy they are, no matter how successful they are. Can people still suffer from depression? Absolutely. First things first, let's define what depression is. According to the American Psychological Association, depression is a low, sad state and a feeling of being overwhelmed. Depression interferes with our day-to-day function. Now, day-to-day functioning meaning relationships, work, school, just about anything. We may have trouble getting up in the morning. So, types of depression may vary. You may have something called situational depression, or what is known as adjustment disorder with depressed mood. And what that means is that can last anywhere from 6 months to a year. If it persists longer than those categories that I described for you, longer than a year, you could be suffering from something called major depression. We also have something called seasonal affective disorder. We don't see it so much here in Florida, but we do see it in, of course, the northern states where there is snow. Get it? Seasonal affective disorder, sad. You're sad because, of course, you're in the snow. You're not out exposed to the sun. The sun increases levels of serotonin, which are our mood modulators. Now, what are our classic signs of depression? Well, first things first. You're sad. You're sad when you should be happy. You're anxious. You have feelings of hopelessness, guilt. You have a loss of interest in the things that you normally found pleasure in. You have difficulty having fun with friends and family. You have changes in appetite. You could be eating too much, not eating enough. Sleep, we also see as a predominant factor. Sleeping too much or not sleeping enough. Chronic insomnia. In addition to those factors, you also have physical factors that can present when you're feeling depressed. Chronic headaches. You have gastrointestinal illnesses, chronic stomach problems, running to the bathroom. You may also have aches and pains that weren't there maybe 2 months ago, but when the depression becomes so overwhelming, you start to feel those aches and those pains. Now, according to the National Institute of Mental Health, depression affects 30% of college students at one point or another during their stay at college. Now, what does that mean? That means that depression can impact their academic performance, again, their relationships, and their job performance as well. But what we also see in the college population, in addition to the depression, is something called comorbidity, which is you may have depression, but you may also be drinking, drugging, okay, or have another type of an illness. So we oftentimes see, in addition to the depression, something else that goes along with that. Now, the National Institute of Mental Health and the American Psychological Association also state that there's an estimated 1 in 10 adults per year that report having depression. Just about half of those Americans will seek out treatment. Now, when you think about being depressed and you think about it can be so overwhelming, a lot of these people are not seeking help. And I think what's so wonderful today is that you have guest speakers here, you have you that are here that are interested in saying, wow, I may not have depression, but I may know someone in my family or have friends that suffer from depression. What can I do about that? You can make the proper referrals, and you're going to have people here today that are going to talk a little bit more about that. I want to talk about treatment. Treatment is not just psychotherapy or therapy or counseling. It can be a part of that component, but we also have to look at the fact that depression can also be biological and biochemical. And if we're looking at a biological or biochemical predisposition, then do we have to treat with a medication? Yes, we do, because it's not going to go away on its own. So what types of medications are we looking at? Well, there's quite a few that I'm sure that you've seen advertised on TV. Celexa, Lexapro, Cymbalta, Prestige. Those are some that we do use to treat depression. If we're talking about bipolar disorder, we may need to treat that with something called Lamictal, Depakote, Tegretol, Latuda is a brand new one that's on the market. So depending upon the type of depression you have, depending upon the severity, it's going to warrant a different type of a protocol or a different type of a regimen. Now, people always ask me in my classes, they say, Dr. Shoemaker, can't we just exercise? Can't we just go out in the sun? Can't we just take some supplements? Now, am I going to tell you, yes, do I want you doing all of that? 100%. But is that going to cure the depression? No. Is it going to help elevate your mood? Absolutely. Just like meditation would, enjoying your favorite hobby would, but you would have to actually have a combination of both. So we can look at therapy, we can look at medication, and we can also look at enjoying activities which are going to elevate your mood. I'm going to say the most significant thing that I try to teach my students as well as my patients, because again, as they mentioned in the opening, I specialize in anxiety and depression, obsessive compulsive disorder, bipolar disorder. I'm going to tell you that attitude is key. Your attitude. I'm going to say PMA, positive mental attitude. If you go into saying, I need help and I want to help myself, you've got the battle half won right there. Being optimistic versus pessimistic decreases depressive episodes. So if you're seeing the glass half full instead of half empty, is that good? 100%. Finally, focus on what you have versus what you don't have. You have made an effort to go in and get help. And like I said, the battle is half won just going in and saying, I need help. I don't know why I feel the way I'm feeling. I've lost interest in the things that I normally did enjoy. I want to feel better. And so in that regard, I think if we educate ourselves in looking at depression and understanding the signs, the symptoms, and where to go, you are well on your way to recovery. I thank you very much. Are there any questions at all that you might have? Anything? Yes, please.
Is the medication that you be dependent on it? Do you depend on the medication like physiologically?
Physiologically, no. Okay. When you have a biochemical imbalance in the brain, you need that medication in order to elicit those neurotransmitters to get working again. So that medication is just like a support system for you. And it helps you to function. It helps you to see things more clearly and more rationally. Anybody else have a question? Yes?
With the medication, are you, after you, for example, you put the person on medication,
Right.
and you've seen improvement on them, do they get weaned off of it?
Now that's a very interesting question, and that's going to be dependent upon the psychiatrist or the primary care doctor that puts them on the medication. I'll tell you, with some patients, not with all, they see signs of improvement and they decide to take themselves off the medication because they're all better now. But go back to what I said about a biochemical imbalance versus someone who's just suffering from an adjustment disorder or a situation. And you and I all encounter depressive situations. We lose someone due to an illness or an accident. There's a breakup that occurs. We lose a job, money issues. Can that make us feel depressed? But that's not biochemically related. Okay. So with the medication, clearly we would have to modulate that. Can you decrease? Absolutely. Yeah. Anyone else? Thank you again very much.
Do we have any more questions? I have time for one last question. Thank you very much, Dr. Shoemaker. Our second speaker this afternoon is Mr. Evan Huey from Henderson Behavioral Health. Mr. Huey has over 8 years in behavioral health field and is Florida licensed mental health counselor, certified addiction professional, and international certified alcohol and drug counselor with a Master's of Arts in Counseling Psychology from Trinity International University. Mr. Huey's experience has spanned working with children and adults in various community settings, including financial service industry, churches, community health, and homeless shelter. He is also a member of the Mobile Crisis Response Team for Inpatient Hospitalization. He joined Henderson Behavioral Health in January 2011 and has been providing individual, couples, and family counseling to the student body of Broward College since then. Mr. Huey will talk about understanding the signs of depression and suicide. Let's put our hands together for Mr. Huey.
Health. We're currently located, you hear me correct? You repeat, are you all hearing me fine? Okay. I mean, our address is 3538 South University Drive in Davis, Florida. And we are close to the Nova bookstore. Now, what some of the services that we do provide is that we do individual, family, and couples counseling. We also provide psychiatric services to clients. And we do have, for the broad college population, an on-call counselor who is available 24 hours, 365 days per year. Now, what are some things that we do? Henderson Student Counseling Services provides the opportunity for students to benefit from working on personal issues. A behavioral health professional can suggest ways to cope and to better understand what's going on in your life at that moment. The counseling center is staffed by experienced, licensed behavioral health professionals, including licensed psychologists and psychiatrists and therapists. So what does this mean? Students are provided with the opportunity to express their emotions in an uninhibited and safe environment. Now, the counseling relationship, it is objective, it's non-judgmental, and understanding. Most importantly, the counseling relationship, it is strictly confidential. Now, some of the concerns that we do work with the students that do take advantage of the service are relationship challenges, stress and time management, test and seminar anxiety, academic concerns and career development, depression, problem solving and goal setting, substance abuse, and adjustment to student life. You know, realizing that the population varies from very young to those who have been out of college for a long time. So how do I now get adjusted, to college life? So those are some of the issues that we do work with when it comes to our population. Now, the hours of operation is Monday through Friday from 9 to 5 a.m. As I said before, there's a counselor who is on call 24 hours a day, 7 days a week, 365 days a year. Now, the Dr. Hannah already spoke about depression. What is depression? Depression is a common but serious mental illness, and it's typically marked by sad, anxious feelings. Now, most college students occasionally feel sad or anxious, but these emotions usually pass away quickly, within a couple of days. Untreated depression, however, lasts for a long time, and as the doctor said before, it interferes with day-to-day activities and day-to-day functioning, and is much more than just being a little down or feeling blue. According to the American College of Health Association National College Health Assessment, a nationwide survey of students at 2- and 4-year college institutions found that 30% of college students reported feeling so depressed that it was difficult to function at some time in the past year. 30%. So that's a pretty high rate among college students. You're looking and saying, why should college students be depressed? They're only going to school studying. But you know what? There's so much issue that they have to deal with in this day and time. More than 11% of college students have been diagnosed or treated for anxiety in the past year. And more than 10% reported being diagnosed or treated for depression. So you're not alone in this process. There's a whole lot of individuals, a whole lot of students who suffer from these, from depression. 64% of young adults who are no longer in college are not attending college because of mental health related reasons. Whether it's depression, whether it's bipolar disorder, post-traumatic stress disorder, are some of the primary diagnoses of these young adults. 31% of college students have felt so depressed in the past year that it was difficult to function. And more than 50% have felt overwhelming anxiety, making it hard for them to succeed academically. Now, concerns of stigma is the #1 reason why students do not seek help. Now, what are some of the signs and the symptoms of depression? You feel sad, you feel anxious, you feel empty, feeling of hopelessness, there's feeling of guilt, you feel worthless, helpless, powerless, irritable, you're restless, there's a loss of interest in activities that you once enjoyed, there's a lack of energy, you got problem focusing and concentrating, remembering and recalling information and making decisions. You have problem falling asleep, problem staying asleep, or sleeping too much. There's a loss of appetite or eating too much. There are thoughts of suicide or suicide attempts. There are aches, headaches, cramps, or digestive problems that do not go away. Now, what are some warning signs? There are dramatic changes, both positive and negative, in the person's behavior. There's confused thinking, prolonged depression, social withdrawal or isolating, disturbing writing or verbalization. There's denial of obvious problem. I'm not depressed. I'm not using drugs. So, denial is a strong indicator. There's substance use. There's a strong feeling of anger and growing inability to cope. No longer are they patient to deal with the challenges. They're irritable, easily upset. Get angry easily. Now, because depression and suicide is so closely related, I do have some statistics here that I'll give you in a minute. According to the Center for Disease Control, suicide death caused by self-directed injurious behavior with an intent to die as a result of the behavior. So the intent is to hurt themselves. Now, their suicide attempt is a non-fatal, self-directed, potentially injurious behavior with an intent to die as a result of the behavior. An attempt may or may not result in injury. And suicidal ideation is considering or planning for suicide. Now, what are some of the risk factors, according to the CDC, that one should look for? Family history of suicide predisposes this person to a greater risk of using suicide as an attempt to cope. Family history of child maltreatment, previous suicide attempts, history of mental disorder, particularly clinical depression, feeling of hopelessness, impulsive or aggressive tendencies, and these are just a few that you can read at your leisure. What are some protective factors that would help someone from wanting to commit suicide? Effective clinical care for mental, physical, and substance abuse disorder. If the person is in treatment, if the person has a support system, that would be helpful, and it acts as a deterrent from that person wanting to carry out their suicide intent. Easy access to a variety of clinical intervention and support for seeking help. Family and community support system, it is so important. One of the things that we come across in our practice is, when you ask, who are your support system? Who does your support system consist of? There's no one. You're all by themselves. And without support system, whether it's community support system or personal support system, the journey becomes much more difficult because if there are obvious signs, there's no one around this person to say, what, John, Mary, need some help. Let me refer you to this place where you can get some help. Support for ongoing medical and mental care relationship, skills in problem solving, conflict resolution, and non-violent way of handling disputes. Now, there are many reasons why people don't seek treatment. The misconception that people talk about suicide, they won't really do it. That's one of the misconceptions that's out there. Another misconception, anyone who tries to kill themselves must be crazy. If a person is determined to kill themselves, nothing is going to stop them. This is so not true. And people who complete suicide are people who were unwilling to seek help. And you can go through the handout and see, the different misconception as to why people do not seek treatment. But depression is a real problem in our community, in our society. As the statistics said, 30% of college students at one point or the other suffer from symptoms of depression. And then that leads them, to want to hurt themselves, want to commit suicide. Now, what are some resources that's available to someone? What do you do? Anytime you engage a student or a friend or acquaintance and you have a feeling or concern or a red flag goes up, there's certain things that you can do to help this individual. You can call Henderson Student Counseling Service for a suggestion. And that number is 954-424-6916, and it's all is posted. I mean, you can speak to your professor. It's posted on flyers around the campus. I mean, that service is available to you 24 hours, 365 days during the year. You can also call 911. You can call the Henderson Mobile Crisis Team. We'll go into the community, we'll evaluate that individual and see what service they need. And provide, if they need hospitalization at that time, we'll also, do the paperwork and ensure that they're safe. Because at that moment, the client's safety is the most important. Now, what are some resources? Call 911. You can contact your school, local body. Talk to someone, talk to your professor, or the suicide hotline. And these are just a few places that you can contact and get help. Now, at this time, do you have any questions? They're indecisive. They don't know, should I do this, should I go here? They're just confused. Their thinking is not clear, not able to make sound decision. So they become confused. And I mean, confused could be caused by many reasons. Maybe, as the professor mentioned earlier on, they might be using alcohol, they might be, there are other symptoms that could cause it, but it's one of the signs. I mean, if someone is confused and they're indecisive and don't know, what to do, where to do, how to do it, there is something going on. And this person should be referred to get some help. Thank you. Any other questions?
Would you please explain to us how is the service or the relationship between our college and the centers?
Okay. Now, Henderson Student Counseling Service, we do provide, as long as you're registered and you're attending Broward College, whether it's part-time, full-time, you're entitled to the service. You do get 6 therapy sessions. The first session is an evaluation. So you come and you get evaluated. After the evaluation, based on the information that you do provide, a treatment plan will be developed. The treatment plan normally looks at the problem that brought you into service. In this case, it will be depression. It looks at your goal. What is it that you're hoping to accomplish? I want to be happy. I want to, to be able to focus and to concentrate. Whatever your goal is. It looks at the interventions that will be used, which is a combination of psychiatric services and therapy. There are those who, the depression may not be severe enough for medication, but I mean, it's usually a combination of both that gives the most effective result. And it looks at the objective, which are usually small steps to helping it to accomplish the larger goal. So it is 6 sessions, and it's over a 12-month period.
And the contact information is anonymous? I mean, we have to find out about it, or you just
No.
call you straight?
No, matter of fact, I mean, if you, there's some flyers that's posted on campus, and what it looks like.
I'm about to go to sleep.
Yeah. I mean, if these flyers posted anywhere on campus, in the offices, the contact information is here. So you can always read it and just contact us. So once you're registered and attending, you do qualify for services. And it's 6 sessions. And at the end of your first year, you can come back in for service on your anniversary. So if you start today, which is October 9th of 2015, you'll take another 6 sessions as long as you're registered and attending. However, if you do see the psychiatrist, we're treating you for depression, we'll link you with service within our agents, within Henderson. So you'll get the 6th therapy session in the new year. But because you are already linked with psychiatric services, you would not see the psychiatrist for our program, only the very first year. Any other questions?
Yeah, I just so 6 sessions per year. And also, how can you differentiate a patient that is a hypochondriac with someone that actually has depression?
When you look at the symptoms, of depression, there's a loss of motivation, there's a loss of interest in things you once enjoyed. You're sad, it's hard for you, you don't want to get up out of your bed, you're missing class, you're missing work. It's interfering with your day-to-day functioning. So anything at all that starts to interfere with your day-to-day functioning, at that point you know that there's something going on here and I need to get help. It doesn't matter what it is. As long as your functioning has deteriorated, that's a sign that one needs to go and get some help. Because if left untreated, nothing is going to change for the better, only for the worse. So, any other questions? Well, thank you very much for having us.
Thank you, Mr. Cooley. Our next speaker is Ms. Ariana Alexander from the Pompano Beach Vet Center. Ms. Alexander is a licensed clinical social worker in the state of Florida with a strong background in providing treatment and services to adults, children, and families who have survived physical abuse, sexual abuse, emotional abuse, neglect, and maltreatment. Ms. Alexander has provided treatment to individuals diagnosed with post-traumatic stress disorder, depression, bipolar disorder, and other mental health diagnoses. Ms. Alexander has been in the field of social work for over 20 years. She is the readjustment counselor at the Pompano Beach Vet Center and the Women Veterans Outreach Coordinator for the Vet Center. She will talk about combat, veterans, and depression as it relates to things to consider. Let's give a warm welcome for Ms. Ariana Alexander.
Thank you. I'm going to put in my USB cord.
Another PowerPoint. That's cute. Richard, hold this. I'm about to go to sleep. We'll be right back. No, they're principal. You want to do it?
Okay, I'm going to touch on the definitions of depression, and I'll go over that briefly since you've heard the definitions. The causes of depression, stressors that are specific to our veterans returning from combat, readjustment to civilian life, and resources available to our veterans. It's important to remember that depression is an illness. When you approach depression from the disease model and a concept of disease, then it reduces the stigma that comes behind it. People seldom question if you're diabetic whether you need insulin. People rarely question if you have heart disease or you have high blood pressure, whether you need to take medication. But they question if you have a chemical imbalance, whether you need further assistance. or maybe possibly medication. So when you come and you view depression from the disease model and that concept, then that destigmatizes depression. Depression is a feeling of sadness. It's not the general sadness you feel from life events, you know, I'm kind of down today, things have gotten me just a little bit sad. It's an overall feeling of hopelessness, sometimes helplessness. You withdraw from people that you care about. Things that you used to enjoy just don't really have that, you don't have that feeling for it anymore. It's almost like a struggle to even engage in those things that you care about and be around the people that you care about. You have very little energy. So people with depression, they have to motivate themselves sometimes to even get out of bed, to pick up a book and read for class. And it's often exacerbated by stressful situations. So again, depression is a disease or an illness, a combination of family history. So your genes, some of us are predisposed for depression, just like we're predisposed for, again, like I said, diabetes or heart disease, and especially if it's a first generation, your parents or your aunts and uncles. If anyone is diagnosed with depression, then you're more likely to be predisposed to depression. If you have a history of maltreatment as a child abuse, neglect, living in a chaotic situation, it also predisposes you to depression. And so you couple that with stressful life events. Now, life events can be positive and be stressful at the same time. So, for example, going to school, that's positive. You're furthering your education, you're going out in the world, you're going to teach people new things. You're like you're our hope. But it's stressful, right? You know, staying up at night. Who gets stressed out? Right. Running to class. Who works as well? Okay, so balancing out work and school, that's very stressful. And even though it's a good thing, it can also be stressful. But then you have those relationship things that happen. You break up with your boyfriend or your girlfriend, and you know, you get in a fight with your sister. You know, those things are stressful as well. So you have this predisposition, and then you have these life events that can be quite stressful, a death in the family, and that can cause depression. Health problems. If you're anemic, people that suffer from anemia have a lot of times are depressed too, or an underactive thyroid gland. So sometimes medical conditions can exacerbate depression, and when you treat those medical conditions, you can also, you know, reduce or alleviate the depression as well. But neurotransmitters are out of balance. And sometimes you can't handle that on your own, and you may need medication. Just like if I had high blood pressure, I would go to my doctor. I've tried exercise, I've tried, you know, my diet, I've tried all of these stress reducing things, and I might need a little more help. So there are specific stressors that veterans that have been in combat go through. So you add maybe a predisposition for depression or traumatic life events like combat, and that can cause depressive symptoms as well, or depression. When a veteran or when a soldier's in a combat zone, he may be his MOS, or that's what he's assigned to do. His assignment might be to transport materials to and from one base to another. He's not infantry. However, if sometimes going from one base to another or going from one place to another, there may be mortar fire. He may be, face death, there's mortar fire. Does anyone know what mortar fire is? Okay, what's mortar fire?
It's an incoming rocket from ground-based launches.
Mm-hmm. And sometimes they, what the enemy will do is they will fire things over the base. It may not reach it, but it may reach it. So you're in constant fear for your life. So there's no safe job. You think that you're just transporting, your life is in danger. You think that you're in the kitchen, you're cooking for the base. Mortar fire. There's no safe job, and there's no safe place to be when you're in a combat zone. So when you go into the military as an 18, 19, 20-year-old, in your development, everything is really exciting. It's just like when you start school, things are just exciting, and you're starting something new and you're learning something new. And when you go into basic training, you have that concept. I'm excited, I'm going to, and when you find out you're going to be deployed, you're fighting for your country, and you have a sense of purpose. But when you go into a combat zone, you question that sense of purpose, because you see a lot of atrocities, and then you begin to, question, what am I doing, or question things that you're doing. And that's natural to do that. You still believe in the cause, but you begin to question because you've seen so many things that you just weren't expecting to see. So there's a general, you can't have a general distrust for, the government or authority figures. You may not, you're trained to follow orders, but you may have there may have been an order and then someone was killed. So begins to be a general distrust of authority figures and maybe the government itself. There's physical pain. When a soldier comes back from combat, there can be physical pain. They're on long missions. The equipment is uncomfortable. They have things on their back, So there are sometimes physical things that, and medical things that happen from being in combat. Post-traumatic stress. And when post-traumatic stress is when you are in constant fear for your life. It develops from being in constant fear of your life and over a prolonged period of time. And when you are in danger, or you feel you're in danger for a prolonged period of time, it changes the chemical imbalance in your brain, if that makes sense. So you'll see they'll have a general sense of fear. A lot of anger or rage, and they don't understand what's going on within them. Does anyone know any veterans? And when we try to figure out how we can help them or what's going on, you might see sleep problems, can't fall asleep. Once they fall asleep, they may jump up in the middle of the night. So they're bringing home other issues. Traumatic brain injuries. If you have, if you've been hit by a rocket or you've gone over a mine and things have been blowing up in front of you, you can get traumatic brain injury. And when you have a traumatic brain injury, that also changes the chemicals in your brain. It affects, the way you think, the way you feel. There's a physical change in the brain and therefore in the body. And then there's just the general readjustment to civilian life. Being in the military, who here has been in the military? Okay, all right. How is life in the military?
You get
free medical care for you and your family, you get housing allowance, you get almost, unless you're going to provide for you, you don't have to worry about nothing. But when you go to civilian life, you lose the medical care, and you lose some vacation time, and you lose a sense of security, and you have to find something new.
Absolutely, because, and what else? How, you were in the military. Thank you for your service, children. Tell me, what is different between military life and civilian life?
Basically, what happens usually with, I see with young soldiers coming in is that they get used to the regimen of someone telling you always what you have to do at all times. And it can be a problem when they get out of that active duty side, or they come back from deployment because no one's telling them anymore, oh, you need to wake up at this time, and you need to eat at this time, and you need to do this at this time. So they get a lot of them get anxious. A lot of my soldiers, they're real like jumpy about, you know, trying to figure out what they want to do with their life, because a lot of them are young, they're 19, 20, and they're just not used to the structure, the non-structure, because they've been in the structure so long. So they usually get depressed about not being able to find a job or not being able to fit in with this society that's out here. And they oftentimes want to go back active again.
And that is true. When there's a structure, you're coming from a structured setting where you know what you're supposed to do. You know where your meals are coming from. You know what your duties are. You know everything is, you know, is done. You know what to do. You know your place. You know what you're supposed to do in this whole mechanism of things. And when you get out of the military, it's kind of like what to do. What to do now. And also, when you're 18, 19, and 20 years old and you've been in combat, and you've been in a combat zone, you also have bonds with the people that you were in that combat zone with. You know, because and then you come out into civilian life and no one really knows what you've been through. You know, they can't relate. You know, so those are stressors that are specific to veterans, and especially veterans that have been in combat or in combat zones. So they may experience marriage and relationship problems. You know, a lot of spouses will say, you know, this isn't the same person that I was with. You know, where's the person? You know, they didn't come back. You know, because they are a different person. You know, when you start college, you won't be the same person that you are. You know, you were when you began. But they're coming back having different experiences. Medical issues, financial hardship, you know, like he mentioned earlier, you know, not being able to find a job. You know, there's anger behind that, you know. Endless questions from family and friends. You know, a lot of veterans, you know, they get so upset because, you know, they'll ask them, have you killed anybody? How many people did you kill? You know, that's, you know, and they don't want to relive that. You know, there are things that happen that they had to do to survive, but yet they don't want to really discuss with anyone. There's guilt and shame that comes along with the things that they had to do to survive. The lack of structure that we talked about. Feelings of isolation. When you're around people, you know, you can be in a whole room full of people and feel completely alone because they don't understand your experience. Nightmares, sleeplessness, and lack of motivation or forgetfulness, and that can be from the traumatic brain injury, or that can be just from the readjustment. So this is so things to consider. If a veteran seems depressed or suicidal or appears to be having other significant problems, it's important to seek consultation. from individuals who have experience working with combat veterans. And I'll have a list of resources that you can access. And also I'll have my card out if you needed to call me. This can be done at the local vet center. The vet centers are smaller little clinics. They're for readjustment counseling. We provide marriage and family counseling, individual counseling, employment counseling, whatever a veteran needs in order to readjust back to civilian life. But that doesn't necessarily mean a recent veteran. This can our oldest veteran is from World War II. So they're still struggling with the things that they had to live through combat. And then there's the broader VA system. We work closely with the outpatient clinic that's in Sunrise, where the psychiatrists are, and we consult all of the time. Henderson, they have Mission United, which is, they work with veterans on readjustment. They have a program that works with OIF veterans, free of charge. So just having that brief discussion, having that consultation with others who have expertise working with combat veterans is helpful. And we're always open to talk to other professionals. Veterans are very, very reluctant to receive help. In general, people are reluctant when they're dealing with depression. Veterans, it's almost heightened so because they see disease, depression, they don't see it as a disease, they may see it as a weakness or as a character flaw, which it's not. And one of the first things that I do with my veterans is psychoeducate them on the medical piece of depression or PTSD or whatever they're suffering, so that they can get an understanding of that. So it's important and having forums like this is very important so that you can get information. The community needs to be involved and understand some things, and so also the school. So these are just a list of places in the area: the Pompano Beach Vet Center, and then I'll leave flyers in the back. There's the Fort Lauderdale Vet Center, and what the vet centers do is we have them centrally located so it's easy for the veteran to access. Of course, we have the Miami VA Medical Center, the Palm Beach Center, Jupiter. That's a little far, but the College Counseling Center. We try to work closely with the colleges in order to let the colleges know that we do have services for veterans, and if they want to consult with us, then we encourage that. And then a lot of the VA Benefits Administration is a good one because to get service connected, the veterans know, being service connected about. And then the Florida Department of Veterans Affairs. So those are a list of resources, and I'll have my card in the back if you need to. This is a 1-800 number that we have, a Veterans Crisis Line. It's 24 hours, 7 days a week to be accessed. Or you can get online and do a live chat. But it's not only for veterans, it's for friends and family, in order to try to support the veteran. And that is me. Are there any questions? Yes.
For example, I have suffered from depression and also like that, but I want to ask you, I know that I have a big but what happens, for example, if two people are put in the same situation and under the same pressure, how come one person gets a imbalance in the brain, not the other one? I think that's why people think they're weak.
people have different tolerances for stress. You know, each individual is different. There are a lot of different factors, and I try to parallel it to any other kind of disease that we can talk about. It's just kind of like, let's take diabetes, for instance. You know, someone may need more insulin to regulate, you know, their hormonal levels, you know, their blood sugar levels, whereas someone may need less. So it just depends on the amount of the hormonal or the imbalance, and also the other support systems that they may have in their lives, the different protective factors that they have. So yeah, you can have two people that experience the same thing, but they don't experience it in the same way because we're not the same people. Yes.
I experienced it myself when I got out of the service. I was tired of the instruction, like they're telling me, instead of asking you, like most employers do, we need you to work some extra hours. Are you going to do something? No, I got plans, so okay. But in the military, we need you to work a few more extra hours. Like, but I have plans with my, no, it's still puts their value. You say, yes, sir, and I have problems with, I had a job when I got out of service, people telling me, mandatory mandates saying you have to work 4 more hours. I had a problem with that kind of job because this is civilian life. You can't tell people when to work and when not to work.
And you know, and that is another response from getting out of the military. You know, you don't want that structure anymore, or if you develop a general distrust for the authority figures, you might fight against that. You know, you're not going to tell me what to do anymore. So that is the same side of that's another side of the same coin. Is that the right term? Yes. Thank you. Any other questions?